All right, so welcome back to part three of our appendicular skeleton lecture. So in this part, this is going to be a relatively brief and short part, but here we're going to look at the pelvis as well as the pelvic girdle before progressing into talking about the bones of the lower limb. So just like we had the pectoral girdle that was supporting our shoulder, so we had our clavicle and we had our scapula, we also have the pelvic girdle, which is doing the same thing, but it's supporting our lower limb. So this is going to be a few bones that are supporting our leg. All right. So if we look here, we can see that it's actually made of three separate bones that are fused together. Right. So you have this large bone here in yellow. This is called the ilium. You have this bone here in red that is called the ischium. And then you have this blue bone here. It's not really blue in the body, but it's blue here, and it is called the pubis. All right. Now, this ilium, if you put your hands on your hips, uh, you are pushing on this large crest here that is called the iliac crest that we'll look at in a second. Whenever you sit, you're sitting on this region down here of the ischium called the ischial tuberosity, and where your two pelvic bones meet and where they join, so the right and the left, they join and they fuse, or they don't fuse, but they articulate here at the pubis. All right, so those are some kind of relevant landmarks and some relevant functions of these bones. Now, where they fuse, you can see that you have this large ball, this large cavity, right? So this large socket. So the hip, like the shoulder, is a ball and socket joint. And so it allows for a good range of movement. And in chapter 7, whenever we do our articulations lecture, we'll look at the relationship between the mobility of a joint, so the hip joint here and the shoulder joint. So we'll look at the mobility, and then we'll also look at the stability, and we'll see what the relationship is between the mobility of a joint as well as the stability of the joint. Right. So this socket here that forms the socket of the ball and socket joint of the hip, this is known as the acetabulum. And so during development, these three bones are separate and they are not fused, and they slowly begin growing together and they ultimately fuse, and where they fuse is in this region known as the acetabulum. The head of the femur that we'll look at in a second will come up in here and make the ball in the ball and socket joint. Right. So this whole bone here, sometimes this is referred to as the innominate bone, which means no name, even though it has three separate bones that all have a name, is sometimes also referred to as the os coxae, all right, or the os coxa if you're talking about one. Okay. All right. So if we look at some more details of these three bones, we'll look in detail at the ilium, the ischium, and the pubis. All right. So you have the ala. The ala is this large wing here, this large broad surface that you see here that makes up the majority of the ilium. You then have the iliac crest, which is the region that we said if you set your hands on your hips, your hands are on your iliac crest. And you can sometimes see the iliac crest as well, kind of protruding through the skin. And then you have what are called iliac spines. And a spine is just a projection of a bone, all right? So in this case, for the ilium, you have anterior and posterior, and you also have superior and inferior. So you have an anterior superior iliac spine, an anterior inferior iliac spine, posterior superior iliac spine, and a posterior inferior iliac spine. Just like several of the other projections and tuberosities and whatnot that we've alluded to in previous lectures, these are allowing for the attachment of various muscles and ligaments from one area of the body to the hip. So several of the bones, several of the muscles of our quads actually run up and attach to these anterior superior and anterior inferior iliac spines, right? You also have this large opening here, and this large opening is formed in part by the fusion of these three bones. So if we go back here, you can see the ilium, you can see the ischium, and the pubis. So largely from the pubis and ischium is you have this cavity, and this cavity is known as the obturator foramen. Okay, and this obturator foramen allows muscles and it allows some blood vessels and some nerves to pass through as they're going from the pelvic region, maybe out into the perineal region, or maybe out into the proximal leg region. All right. So if we look next, we can see our ischium. So the ischium is, if you are sitting down and watching this, you are probably sitting on your ischium. All right. So the ischium is the second bone here. It has an ischial spine, so this posterior region here that allows for the attachment of a connective tissue ligament in the pelvic region. And then above and below this, um, this ischial spine, you have what are called sciatic notches. All right. So if you are above the spine, you call it the greater sciatic notch. If you are below the spine, you call it the lesser sciatic notch. And various muscles and blood vessels and nerves will pass through this, through these spaces on their way into or out of the pelvic region, right? Now, I said if you were sitting down watching this, you were sitting on your ischium, you are specifically sitting on your ischial tuberosity. So this is kind of the bony region where you can feel whenever you're sitting, especially if you're sitting on something firm or something very hard, not something soft. It's kind of on the posterolateral surface, so it's this region right back here, and you can see it on this lateral view as well. And this is sometimes referred to as the sits bone because this is the bone that bears most of the weight whenever when we are in a seated position. Okay, and then we have our pubis, right? So the pubis is the third bone here. It forms the most anterior aspect of the os coccygis. So this back here, this would be posterior, this would be anterior, and so here you have your pubis protruding out. You have this articular surface where it joins with the other articular surface of the other pubic bone. And where it fuses and where it joins, it creates something known as the pubic symphysis, sometimes referred to as the symphysis pubis, right? And so you also have these pubic rami here. A ramus just means a branch, so you have these two branches kind of radiating out from the pubis. So if we look at the entire pelvis, if we look at the entire os coccygis on both sides, you can see that there are some differences between men and women. So between males and females, there are differences in a couple of things. One, this pelvic inlet. So how wide or how narrow is the space from the inside of one pelvic bone to the inside of the other? You can see that in males, it's relatively thin. Okay, so if we come down here, male pelvic inlet, it's more narrow. And if we see the female, it's much more wide, right? Well, why would this be the case? Why would males and females not have the same shape or the same configuration to their pelvic inlet and their pelvic outlet? Well, it turns out that they need to be different because females are going to be bearing children, or if they choose to bear children, the fetus, specifically the fetal head, is going to have to pass through this region. And so it turns out that it's much more convenient to have a nice wide pelvic outlet and a nice round pelvic inlet to suit the passage of that fetal head. Right. The overall thickness, and you may be able to tell the overall thickness of the pelvic bones is much thicker in males than it is in females. And then the last thing you can look at is this region called the pubic arch. So the pubic arch is the angle between the two pubic bones or the two inferior pubic rami on both sides. In men, it typically is more narrow, while in females it is much more broad. And this is for the same reason. It allows the passage of the fetus, it allows the passage of the fetal head through this pelvic outlet, and this makes childbearing slightly easier as opposed to having to force it through a very narrow or this heart-shaped pelvic inlet here. All right. You also can have some hormonal changes to this pubic symphysis. So this pubic symphysis is a pad of fibrocartilage, and there is a hormone known as relaxin. And relaxin is a hormone that is released during pregnancy and during labor, specifically that allows the pubic symphysis to separate. And so you can actually look at an X-ray of a female's pubic symphysis when it is under the influence of relaxin and when it is not under the influence. And you can see there is a pretty significant difference between the space between the two pubic bones when you have this relaxin hormone versus when you do not have this relaxin hormone. It turns out that the relaxin also affects other connective tissues in the body, so other joints and other ligaments. And so you can have other complications with other joints as a result of this relaxin, and it's not specific just to the pubic symphysis. So it can have more systemic effects, right? So let's answer this question here. So you can pause the video, read the question, try to answer it, and I will move on. So how is the female pelvis different from the male pelvis? The answer is A, right? So the pelvic inlet is round or oval. So if we go back here, you can see in females it is round or oval, whereas in men it is more heart-shaped, and then the outlet is narrower in men and is much more wide in females. Okay, more prominent processes and features. This is a feature of the male pelvis, not the female. Thicker and more massive. Again, this is more for the male. And pubic arch is acute angle less than 90. This is also true for the male as well. All right, so we will stop here and we will pick up with part 4 by talking about the bones of the lower limb.